Good evening, America. It is 5 o'clock on the Gulf Coast, which means 6 o'clock in the East and 3 o'clock in the West. And I'm Dr. Randy Fink. Welcome to Fertility with Fink, our weekly chat about all things female and fertility and gynecology and everything else you could want to know about. It's great to see everybody. Hi to Angela. Thank you for clarifying the name there because, boy, that handle is a tough one. Joining us first here, Sharmila, welcome. And Rosa SD, you are our first two to join right here. We have, who else? Shay Dunn, T. Andres, Roz Johnson, Nurture Shanna, hello, good evening. Live Like Coco. Hey to Shay Dunn. Let's see. We've got a couple of different feeds going on here. We've got my Instagram feed right here in the middle. We've got New Life Fertility over here. We have New Life's Facebook. We have an Instagram, a YouTube and a LinkedIn, all coming over here so we can catch you from every place you would want to be. So happy to see everyone here tonight. Hopefully your week last week was as meaningful as mine was. Last week happened to be National Infertility Awareness Week. And in National Infertility Awareness Week, we turn our thoughts and really focus on all those who are suffering through and dealing with the problems associated with infertility. It's a way more common problem than most people realize. 1 in 6 couples suffers with infertility. And, you know, the most important lesson that I get from National Infertility Awareness Week was very simply that you're not alone. There is a very large group of people out there who are here to support you through this process and really whose sole goal is to be with you every step of the way on this journey to fertility. You know, bringing a family out of what seems like nothing may seem like a miracle to many people. And as I always say, when you hold that baby in your arms, it really truly does feel like a miracle. But in reality, the science of what we do is pretty straightforward stuff. A lot of folks become very frightened by the idea of fertility treatments and what they may have to undergo. How badly is it going to hurt? How much is it going to cost? But at the end of the day, the process has really been made straightforward. It's something that everyone has the capacity to do. There are so many fish in the sea who can help you through this process. So I encourage everyone to seek the counsel of someone who you really trust when it comes to fertility, because together we can get through this problem and really make a dream come true. And that's kind of what it's all about. We are here every Tuesday evening at 5 o'clock. I am I'm the fertility gynecologist here at New Life Fertility in Pensacola, Florida. We are part of the First Fertility Network, which is a nationwide group of first-class practices in reproductive endocrinology and infertility, IVF. Check us out on the web at firstfertility.com. So that said, who else we have here? Zinni is here, of course, from Miami. Thank you so much for being here. Hey to Reagan is here. Nice to see you there. You were the first to join. Happy Tuesday. I've got Brandis right here, my former colleague in Colorado Springs. Thank you, Brandis, so much for being here. Journey to Baby W. Hello to Tracy in Miami. Hey to Julep. Mariah, Live Like Coco says, hey, Dr. Fink, what do you think about the Mira testing kits? You know, it's the Mira kits are designed to help you understand what your hormones are doing. And I think in terms of increasing awareness and making something understandable out of what's going on in your body, it's a good thing. I'm always a little leery about many of these devices and the apps and so forth, things that are trying to get you to part with your money, because, you know, so much of what you see around here is what we'll call financial extraction technology. And And, so govern yourself accordingly. But in my opinion, anything that really gives you meaningful information on what's happening with your cycle is probably good to have. Now, that said, if you're working with a fertility specialist, then the ability to test that stuff is sort of built into what we do in our offices. So the need to purchase or acquire extra stuff to really work your way through hormones and what's happening in your body is probably an unnecessary expense. So that's my 2 cents worth on that. Hey to Natalie. Rosa is currently 13 weeks. Oh my heavens, I can't believe my eyes. Rosa has been through such an ordeal. Congratulations there, Rosa. 13 weeks pregnant. You are really out of the first trimester now. So that means a whole bunch of different things. First of all, it means, well, the risk for spontaneous miscarriage goes down very dramatically after 12 weeks. And that's really probably the most important thing to know. Your baby's growing at a very rapid rate now, and will start. You'll probably start showing pretty soon if you're not already. By the time the uterus is at about a 10-week size or so, 10 or 11 weeks, it's starting to peak up over the bones of the pelvis, and so you might start to see a little bit of a baby bulge there. And certainly as it gets bigger, you see that. And in addition, you get more bloated, and what comes along with that bloating is kind of looking like you're pregnant. Rosa asks, I'm only on prenatal vitamins. I have severe endometriosis. Can my endometriosis cause problems during the pregnancy or cause inflammation? In fact, really, no. Rosa, once you are pregnant, endometriosis becomes suppressed. So you may know that we use different medications in order to suppress endometriosis in the fertility world. Sometimes we use Lupron, sometimes we use Myfembry or Alyssa to medically treat endometriosis. But really the best treatment for endometriosis is pregnancy. Because once you're pregnant, even though you have hormones there, the endometriosis kind of stops getting fed. So I am not familiar with any specific complications associated with pregnancy that are related to endometriosis. Good deal, and thank heavens. It used to be that we would tell folks, don't tell anybody you're pregnant until you're 12 weeks. Because back in the olden days, people didn't get so many ultrasounds early on in the pregnancy. Now, once we look with an ultrasound and we see a heartbeat, we know that the risk for miscarriage drops down to really less than 5%. So interestingly enough, 50% of normal pregnancies will have some cramping and bleeding in the first trimester. So one of the scariest things that can happen to you once you have an early pregnancy is some bleeding. And I will tell you that it's a pretty normal occurrence. It's a pretty common thing and not so much something that you necessarily have to worry about. What can you do about bleeding in the first trimester? Well, sadly, there's not really anything you can do. They've really studied to see, well, what about bed rest? Should you be on bed rest because you have some bleeding? And the answer is no. It really doesn't make much difference. I tell people you kind of want to take it easy. You don't want to be, doing alligator wrestling and bungee jumping and things of that nature, jumping out of airplanes and so forth. But half of normal pregnancies will have some cramping and bleeding in the beginning, and once we see a heartbeat, that is the best news we could hope for. Less than 5% of those pregnancies will end prematurely, and once you're beyond that 12-week mark, that number goes down to really less than 1%. So that's what we're looking at there, Rosa. Hi to all our friends over here on the Facebook and LinkedIn and YouTube side. By the way, throw your questions up here. We'll try to get to them tonight. If we can't get to your questions here live, we do have the ability to see your emails. Feel free to email me at askfertilitywithfink@firstfertility.com. That's askfertilitywithfink@firstfertility.com. And so that said, let us take a look at a couple of questions that we had here. And let's find where they went. Here we go. First one comes from Haley. And Haley says, hoping you can answer my questions. Does NAC cause or potentially cause FSH to increase, specifically in someone with PCOS? And the second question is, what are your thoughts on acai to help with egg quality? Well, so let's work from the bottom up there on that. Acai is a type of berry. It's a potent antioxidant, and there are some fertility practices. There's one I can think of in particular that markets its own acai blend. And tries to sell them to you as a saying it's a fertility benefit. It's really not studied well in fertility and specifically what it does for egg quality, but it's an antioxidant and it's a potent antioxidant. So that means it can't be a bad thing. It is likely not harmful and may be helpful. Now, there are other supplements. There is, of course, an evidence-based protocol for supplements that have been shown in studies very clearly to help with egg quality. So I tend to say let's go with the stuff that's a little bit better researched, just because there's science to very clearly back it up. That's the story on acai. By the way, what is an antioxidant? Let's just cover that here too. Oxidative stress. Oxidative stress happens to the body when we metabolize things. So the chemical reactions in our body, we break down these molecules to form their base particles. And when that happens, you remember that whole business about electrons and protons and neutrons? Well, when things are metabolized, they often throw off a little random electron, and that's what's called a free radical. Maybe you're familiar with the term, the free radical. The free radicals tend to bind to things in our body, like cell membranes, and start to cause inflammation in those cells. What is an antioxidant? An antioxidant is something that combats that formation of free radicals. That is, it decreases what we call oxidative stress. And in the simplest sense, it comes along like a little Pac-Man. I believe it does make that noise, actually. And it eats up those free radicals. It consumes those free radicals. That's what's known as an antioxidant. Where is that most important? Well, certainly as it pertains to cardiovascular health, because inflammation at the level of the blood vessels, especially in the coronary arteries, is what really causes coronary artery disease, which is the most common cause of death in the United States. But as it really probably the world, as it pertains to fertility, though, oxidative stress can have a negative effect on egg quality and on blood flow into the ovaries. And by egg quality, we mean the stability of the DNA of the genetic material that's in those eggs. And so all these antioxidants serve the purpose of trying to help the body restore normal genetic function to those eggs. So that's why we think about antioxidants. NAC is known as N-acetylcysteine. It is also a potent antioxidant, and it is on the evidence-based list of supplements we recommend with regard to egg quality and fertility. So the question is, can it potentially cause FSH to increase, especially in women with PCOS? So interesting that you would bring that up, because there was actually just a study published earlier this year that looked at the effects of NAC, especially in those with polycystic ovarian syndrome. And the answer is yes, it is helpful. How does that work? Well, what they did was called a meta-analysis. And a meta-analysis is where they go and look at all the other studies that have been done on it. They try to find every study that they could find. And they crunch all that data, they put it all together and analyze the data. Instead of one study and one study and one study and one study, they combine all that data and analyze it as one single study. So there may be 30 studies. In fact, I think in this meta-analysis, there were 22 or 25 or so. And so they put all that evidence together. So one of the issues that women with polycystic ovarian syndrome have is they have a little too much of the LH hormone. LH is luteinizing hormone, and maybe not quite enough of the FSH hormone. So if you got a lot of LH but not a lot of FSH, then that causes the eggs to potentially not grow correctly, to maybe not mature correctly, and can end up being problematic because then you don't ovulate. So we say that the LH to FSH ratio in women with polycystic ovaries is off. There's too much LH for the amount of FSH. So what does it do? It may, in fact, increase FSH a little bit. It decreases LH and improves progesterone, and in so doing makes a beneficial effect on women with PCO. Now, does it significantly increase FSH? I believe the study showed that it really didn't have much of an effect on FSH, more than it is changing the ratio by lowering the LH. However, if your FSH went way up, for instance, like it went from a normal of maybe 5 and suddenly you checked in and it was 17, that wouldn't be the kind of thing that we would expect from NAC. That may just be sort of one of those hormonal fluctuations, one of those weird things that happens during the cycle. So hopefully that's helpful information, Haley, but certainly women with PCOS, NAC or N-acetylcysteine and has been shown, even in recent evidence, to be a beneficial supplement. So good deal there. Let's see, there was one other one that came in by email, and that was coming from Jessica. I've been told that my only option is to use either donor egg or to adopt an embryo. I'm 43 years old. My AMH is 0.31 and my FSH is 17.6. My AFC, or the antral follicle count, was 4 small follicles. So the AFC, or the antral follicle count, may not be a great measure of what's going to happen with you. Maybe what's more useful and more predictive is the AMH itself, which is sadly low. When that number gets to be below 1, we consider that diminished ovarian reserve. Certainly below 0.5, I would consider kind of significantly diminished ovarian reserve. If your early cycle FSH is at 17, and in the beginning of the cycle, that FSH hormone should be low because it starts out low and then it increases as your body's trying to recruit follicles. That tells me, I do think that your prognosis would be very guarded there. Could you try to do IVF with numbers like that? Well, remember the medication that we're giving you to get you to make all these eggs. And what's the goal here with IVF? It's, instead of releasing 1 egg a month, we give you medication to try to get you to release as many eggs as you can get. Maybe we can get a year's worth of eggs or 2 years worth of eggs all together at one time. And gosh, that's great, because then those eggs go to the lab, we place a sperm in them, and the next thing you know, we can put an embryo back in you and hopefully get you pregnant. But if your FSH level is already elevated, the medicine that we're giving you is FSH, and those medicines are Gonal-F and Follistim, and they are what's called recombinant FSH. So if we're giving you FSH, but your FSH level is already elevated, the FSH that we give you may not have as much of an effect. Your body's already making a lot of FSH because it's trying to find eggs there for you, is what it's doing. So could you try IVF with numbers like that? You could, but you'd be doing what I would consider to be maybe what we call a closure cycle, which is to say, I don't have a lot of confidence that this is going to give us the results we hope, but it's worth trying. Maybe we give it a try and we see what kind of response you get. Because if you get, let's say, 1 follicle in the ovary from that stimulation, is it worth going through the trouble of having a retrieval? So you might set a limit to say, well, I want to think that I have at least 3 follicles to retrieve. I don't think that that's an unreasonable way to go. So I wouldn't say that your only option there is to use donor egg, Jessica, but certainly it will be an uphill struggle to get the kind of outcomes we want from IVF if those are indeed your number. Whereas if you choose to use a donor egg, the process is very straightforward. Now, nobody goes into the process saying, gosh, I sure hope I can use a donor egg. It's just not, that's not part of our psyche. It's not the way we think about these things. But I used to tell people this, and I will say it again because I think it's important. Using a donor egg does not mean that you're having someone else's baby. Every drop of blood that flows through that baby inside your belly is yours. Every tear that baby cries, every drop of saliva, every ounce of urine, all comes from the fluids that pass through you to your baby. That is your baby for sure. Now we know there is something even more interesting, however, and that is has to do with it's called epigenetics. Epigenetics tells us that there are a series of switches on our genes, a series of switches that can be on or off in any of gazillions of different combinations. It's true that the genetics of the embryo are going to be the ones that say, what color are the eyes? What color are the hair? What color is the hair? What color is the skin tone? How tall is this baby going to be? How, this child going to grow? That is going to come from the genes. But the other things that are related to the epigenetics, things like, will this child be mechanical or artistic? Will this child like poetry or like to build with blocks? Will this child be musical or will this child be vocal? All those individual things. What kind of humor will the child have? How will the child interact with others? What sort of personality may the child have? Comes from the way the switches are either on or off inside your body. And those switches are said to be related to the environment in which that embryo grows, which means the environment of your uterus. So not only is every drop of blood flowing through that baby yours, but much of the genetic programming that takes place that makes your child an individual happens because of epigenetics, because of the switches that are turned on and off inside your uterus. So donor egg is not a failure in any way at all. How does donor egg typically work? There are some clinics that have their own donor egg banks. And when that happens, you have to be careful to know that those eggs are how they're being procured, what kind of cycles are they coming from, because you want them from young, healthy donors in cycles where the donors are not overly hyperstimulated. You want donors that are proven to have had children before. And some clinics use outside agencies. Outside agencies are professionals at basically collecting those eggs and all the information that goes along with them. Those commercial egg banks often have a big library from which you can choose, and you can choose your egg donor based on any number of different criteria, the things that are important to you. The issue that comes with doing a donor egg from a clinic's standpoint is that the FDA is involved. There's a lot of paperwork that has to go into it. So that's why many clinics don't keep their own bank of egg donors and will rely on outside agencies. So thank you so much for your question there, and our fingers are crossed. Our thoughts are with you for sure. Let's see what else we got here. Hi to Maria King, Anne Marie. Oh, hello, Anne Marie. Kaylee is with us. Mr. and Mrs. Polino, Jazzy Poo. Sharmila says, I'm in my third trimester. Do I need to take any medication apart from baby aspirin and low-dose naltrexone and a prenatal. So, the low-dose naltrexone is quite controversial. There are some folks who believe in it very strongly. There are others who say, "Why are you even on that now?" So, the fact that you are, and that is supported by your OB doctor, says that they believe that it's a good thing. Baby aspirin, can have a preventative effect against things like blood clotting problems, and also protective against certain types of blood pressure disorders that can happen during pregnancy, especially in folks who may have gone through things like a frozen embryo transfer. But other than that, your prenatal vitamin, I like fish oil. I think fish oil is important, the omega-3. Why do people want fish oil? Why are you supposed to take fish oil when you're pregnant? What the heck does that even do? Well, so interestingly, the cells that make up our brain are called phospholipids. It's a fatty type of cell. It creates a membrane, as it were, and that's what you're getting when you are using fish oil. Furthermore, it also makes up our retina, the back of the eye. And so you say, okay, so it's making up eye tissue and it's making up something in the brain. Well, that can't be a bad thing, right? No, it's not. In fact, when they study that, they find that offspring of moms using omega-3 supplementation have higher visual acuity scores, and they have higher cerebral or brain function. So that said, heck yeah, I'd take my fish oil. What's the only downside of fish oil? Well, it comes from a fish. And so depending on the type of fish oil capsule you get, you may find that you burp it up. And when you burp up a fish oil capsule, usually it's like a sardine oil or krill oil or something like that. When you burp it up, the very first time you do that, you will say, that is the last time I'm going to ever let this substance pass my lips again, because it is pretty horrific. So if you're going to get fish oil, you want to get something that says it's the odorless or burpless type, because boy, it makes all the difference in the world. It really does. Hi to Kaylin Owens. Thank you for being here as well. Angela says, what causes low fertilization? I have always got 90 to 100% fertilization for 10 IVF cycles with my husband's sperm. I used donor sperm last cycle and got only 2 eggs out of 6 mature eggs fertilized. Well, so, in that scenario there, Angela, it sure sounds like there was a sperm issue. So when we talk about fertilization rates, we think, first of all, is there an egg quality issue? But if you've done 10 other IVF cycles and had 9 out of 10 eggs fertilize, I don't think that that's an egg issue per se. Now, sometimes in IVF, you just get a bad batch of eggs, but what stands to reason there, if you're not getting fertilization, that it may be a male factor. And what could that factor be? Well, most of the time, we would first kind of start to think about something in the sperm's DNA. Is there an excessive amount of what we know as sperm DNA fragmentation? What is DNA fragmentation? Well, what's a sperm? It's like a little package of DNA with a motor on it, right? That's what it is. We can look at a sperm because they have anatomy just like all the rest of us. The sperm have a head, they have a neck, and they have a tail. The DNA portion, the genetic portion, is there in the head. Now, we can't see the DNA. Obviously, that is like electron microscopy kind of thing. But we know that we rely on that genetic material to be able to make that sperm function normally. And if that DNA is kind of starting to come apart, and the term we use for that is fragmented DNA, then that sperm may not function correctly. And certainly if you've had all those other cycles with good fertilization, and now one using donor sperm with no fert, then I would say, or with poor fertilization, I would say that's a male factor issue. Sometimes there can be other things in the a sperm has to go through a process called capacitation. Um, but with ICSI, where we're taking that sperm and placing it directly into the egg, it usually overcomes that kind of problem. So, Angela, that makes me think that there's a DNA fragmentation issue with your sperm donor. DNA fragmentation is something that we can test. We can test through a semen analysis. And there are some things that we do. And you know what? Since we're talking about fragmented DNA sperm, what do we do? Well, there's a couple of things that we can do. Certainly, as it pertains to your donor sperm, Angela, you might consider a different sperm donor. But if in a couple who is going through IVF, and we find that there is seems to be a high what we call fragmentation index in the sperm, the first thing we would say is, well, you want to increase the frequency of ejaculation. The guy says, I can do that. Yeah, okay. I'll do my part there. Not a problem. The first, in a standard kind of semen analysis, or when we collect sperm for IVF, we always say you want to abstain for a few days before you provide the specimen, and that's so that we can maximize the sperm count. Because as you probably know, with repeated ejaculation, the sperm count goes down, but with repeated ejaculation, the sperm quality goes up. So frequency of ejaculation seems to make a difference in terms of DNA fragmentation. There is also some evidence that extracting or aspirating the sperm from the testicle or from a structure around the testicle, the epididymis, and that's called a tessa, can produce sperm that have less DNA fragmentation, that there's some thought that it's the sperm that rather than how it's being created, it's the process of the sperm as it travels through the plumbing to exit that may be creating the issue there. So good luck there, Angela, and thanks so much for being here these last couple of weeks. When is it safe to stop variable progesterone in pregnancy? So in an embryo transfer, we put you on progesterone, because if you did a medicated cycle, your body's not making progesterone. We're giving it to you. If you did a natural type cycle, well, then your body is making its progesterone from the ovary, from the corpus luteum. That progesterone is what keeps the pregnancy going. And you said variable progesterone. I think you probably meant vaginal progesterone. I would say, well, by about 9 weeks, the placenta has taken over making your progesterone. So after that, usually by 10 weeks, we stop the progesterone. There has been some evidence to suggest folks with a history of preterm labor, or rather preterm delivery, might benefit from some extra progesterone, but certainly there by the third trimester, I would say continuing progesterone wouldn't be something I think would be normal. Angela actually asks here too, could it be I got a bad vial of sperm? Could it have been the embryologist was too aggressive with the ICSI? No, I don't think so. As far as aggressive with ICSI, because ICSI really has been studied extensively, because since most cycles in the United States now involve ICSI, trust me, they have looked at every angle of ICSI to try to see, does it damage eggs? Does it damage sperm? Does it create abnormalities in offspring? Does it hurt an embryo? And the answer is pretty much no. The process of ICSI is really very straightforward. And when they collect a sperm from the little dish, it's just really a gentle suction that pulls it in. It goes through the opening in the cell wall of the embryo, or rather of the egg, and it's gently placed inside. So I can't see a scenario where the process of ICSI would have damaged the sperm to any real significant extent. So common things being common, I think it was probably your vial of sperm there or your donor. Hi to Jenny, Runner Girl Training. Nice to see you back here. Miss Hathaway, Shada, hey, how are you? Good to see you here. Rosa said, thankful to you, Dr. Fink, for your knowledge and lives. My pleasure. Nurtured Shanna is another good soul. And Shanna asks, thoughts about riding the Peloton during the waiting time after transfer. Not the same day or anything, but a couple days after. I usually suspend cardio after FETs, but wondering if that would be okay. So do you have to change your life when you have had an embryo transfer? You know, I'll tell you, you've invested an awful lot by that point to get to the point where you can have an embryo transfer. So your instinct is to want to say, I am not leaving the house. I am only riding in a wheelchair. I expect to be fed. I will only eat organic material and all those wonderful things. That I will not have any carbs. I will have no caffeine. I will only think positive thoughts. So that's all good thinking, but doesn't really make a big difference. What makes a big difference, I think, is, like you say, immediately after transfer, I say, I don't want you doing anything that's overly strenuous because that embryo needs a little time to implant. It can sort of float around on the inside, usually depending on what kind of embryo it is, within a couple of days, it will have found its home in the endometrium, in the uterine wall. Well, so if you have strenuous exercise in the beginning, could it shake things up? Yeah, it could. But afterwards, really, I suppose it depends on how intensive your cardio is. I don't think it's the best idea to do intensive cardio because you may be shunting blood away from the uterus, and your uterus badly needs that blood flow. There in the early part of pregnancy. I think it's fine to be on the Peloton, but really for more of a gentle ride. So once you are pregnant, for example, we would tell folks you want to keep your heart rate under about 145. And as you get more and more pregnant, you will find it takes less and less for your heart rate to end up being 145. So I'd kind of govern yourself accordingly there, Shanna. I think it's fine to do some exercise, but I think you're right to do the real high-end cardio and use the Peloton as something you can enjoy rather than as something that you're doing to try to really work up a sweat at that point. Now, that said, if that's really what you've been doing and that's what you're used to, how long do you have to hold that off? You can get back to that pretty quickly, I think. Hi, Megan. Let's see. Another question, is acupuncture after a transfer well researched? Does it make a difference? How much is it needed to have an impact? It can be pricey. Is it worth it? Well, I tell you, there have been conflicting studies on that. And as far as the American Society for Reproductive Medicine says that acupuncture has not been shown to improve outcomes. There have been other studies that have shown acupuncture to improve outcomes. Now, were they great, well-designed studies? Were they big randomized clinical trials with large numbers? No. I would say if you have a skilled acupuncturist and you're comfortable doing it and you can afford it, then it's not a bad thing to do. If it's going to be, hundreds of dollars a week, I don't know that I would necessarily say that you should do. Now, again, I will tell you there are others who feel very strongly otherwise. When I was at my former employer, we had a very, very talented acupuncturist in-house who could do both pre and post transfer acupuncture. I think it cost about $100 or so, 120, something like that, for both the pre and so 2 treatments same day. And I'd say for $100, I mean, that's certainly not a bad expenditure. It's certainly not going to harm anything, and it may just help. Is it necessary to do it on and on over the weeks? I think, to me, that's a harder sell. Let's see. I had a fresh day 5 transfer, and they have me on estrace twice a day. My estrogen level is high at 1400. Could that be harmful? I don't know why they put me on estrace if it's a fresh transfer, not frozen. Well, so you want to just keep that uterine lining supported. So that's the reason for the estrace. The data on estrogen levels, in general, I encourage people not so much to check the levels, because the levels may not really may not make a whole lot of difference as long as the lining is thick enough. If you did a fresh transfer there, Angela, then what's happened is that you still have some residual hormone that came from the stimulation itself, from those follicles. We know from frozen embryo transfers that if you're checking estrogen or estradiol, that a number generally kind of between 200 and about 500 is considered to be optimum. The outcomes are optimum. Now, if you do it and your number's 900, does that mean you shouldn't do the transfer? No, absolutely not, because sometimes it does not mean that, because sometimes transfers can still work. That's considered to be an optimum level between 200 and 500. I'm not sure that the number is all that meaningful in the case of a fresh transfer, just because it's confounded by the other hormones that came from your retrieval. Oh, let's see. Hi to Jazzy Poo. Nice to see you here. By the way, it's about 20 minutes until the top of the hour. You're on Fertility with Fink, and we are here every Tuesday to answer your questions and to be together and to talk about all these things that are important. I'm here for you, and I love being here for you, and I really am appreciative that you are willing to spend a little time with me tonight. If we don't get to your question here, please email them. That's askfertilitywithfink at firstfertility.com. Ask Fertility with Fink at firstfertility.com. Don't forget to follow my Instagram at RandyFinkMD, as well as New Life Fertility here on the Gulf Coast in Pensacola. Jazzy Poo says, what would you recommend for someone who is 36 with adenomyosis, 6 failed IUIs, 1 failed egg retrieval, and 1 failed transfer? Well, so you raise a couple of different points there, Jazz, and that is adenomyosis. First of all, what is that? Adenomyosis is the condition where the uterus has 2 parts, right? There's the muscular part. The job of the muscular part is to squeeze the baby out when that time comes. Inside the muscular part is a glandular part, and that glandular part is what makes a nice, spongy, warm, juicy place for a baby to implant. Well, adenomyosis is where the glandular portion on the inside, and that's the part that kind of sloughs off when you have a period, in fact, grows down into the muscle. It dives into the muscle. It used to be that we could really only make a diagnosis of adenomyosis from a hysterectomy specimen, actually from having a uterus under the microscope. Nowadays, ultrasound has come far enough that we really can see what looks like adenomyosis and can absolutely diagnose it with an MRI. How much of an impact does it have, Jazz, when it comes to pregnancy outcomes? The jury is still really out on that. Does it have some impact? I think it probably does, because it may mean that there's a little bit of a sick endometrium. It may mean that there's some challenge in the blood flow through the muscle of the uterus to the endometrium. So, if it is significant enough, we can treat you with suppression, just like we would for endometriosis. So that would be Lupron or Myfembree or Orilissa in the oral forms. And what that does is that it shuts down the hormonal supply and will allow some of that glandular portion that is invading the muscle to regress, because it is exquisitely sensitive to hormone. It's the lining of your uterus, basically, right? So it responds to hormone, all month long. So that can be helpful. When you say, okay, all the unsuccessful IUIs, I got to tell you, IUI is an option in some cases. I have heard people argue that ethically, it doesn't make sense to offer IUI because the success rates with IVF are so much higher. Of course, the cost of IVF is higher. But if the success rates are so much higher, why should we make someone pay for something that is going to be far, far less successful? And I think it's a good question. I mean, in my opinion, we should still be able to offer people, whatever options they feel most comfortable with. But to tell me that, well, 6 IUIs didn't work, an IUI probably gives you maybe up to about a 10%, up to maybe 9-10% probability of pregnancy per cycle in the general population, compared with about up to a 65% probability per embryo in an IVF cycle. So they're just so, it's so much more effective, that when you say that IUI didn't work for you, it doesn't necessarily mean anything is wrong. When you say that intercourse didn't work with you, it doesn't necessarily mean anything was wrong either. It just may not have worked. Now when you say a failed egg retrieval, and by the way, there's data to show us that after 5 IUI cycles, you are no more likely to get pregnant from IUI than you are from home intercourse. So I really do not encourage people to do more than 5 cycles. I think you're spinning wheels. And it's not just that you're spending money, you're spending emotional capital. And you know exactly what I'm talking about here, because every time you do something and it doesn't work, it seems like it cost years off your life. So that's another good reason that we want things to work. So after 5, I wouldn't do that. And in my mind, even 3 cycles of IUI is a lot, because every month, every time you get a period, you feel like, that you were unsuccessful. And what we want is a baby here, right? When you say a failed egg retrieval, I'm not sure what you mean by a failure. Did you not get any eggs? But I think you must have gotten an egg, because at least you made an embryo, and didn't have a successful transfer. By the way, I don't like to think of, and you may have heard me say this before, I don't like to think of transfers as failures either. You may have had an unsuccessful transfer in that we didn't get the baby we were hoping for, but we learn something from you every single time. We look at these hormone levels, we see the way that your body has responded, and that's very, very valuable information that may help us tweak it next time. So, certainly, Jazz, I have to wonder about how significant is the adenomyosis. What does that mean with the failed egg retrieval, and kind of what the circumstances were with the transfer. But suppression is always an option when it comes to adenomyosis. Hey to Samantha joining us on the fertility, the New Life fertility page. Julep says, what cycle day is best to test the AMH? Well, that's the nice thing about an AMH, is it is not cycle dependent. You, in theory, can test it at any time of the month. So we often have folks in to do some blood tests on cycle day 3. And we look at things like the FSH level on cycle day 3 in the early part of the cycle, because that's pretty predictive of really kind of where your hormones actually are, as far as what that FSH is going to be able to do for you. Because it should be low at that time. If we check that day 3 FSH and it's high, then, oh gosh, that's saying that, well, you're making a lot of FSH because your brain's really looking for eggs, and there may not be very many of them there. So women whose FSH gets above, let's call it 20, we start thinking about that as being potentially a menopausal level. So that's why we look at FSH on day 3, but the AMH you can really test at any point. The AMH comes from the cells that surround every follicle, that surround every egg. Not just the follicles, but the eggs that are buried deep within the ovary there. So you can do that anytime, and that's a good thing. If you don't know what your AMH is, you should. That's probably the singular most important test that we look for in the fertility world, is the AMH. Hi to Leslie. I'm Old Soul. Good to see you there. Hey, Victoria Lynn, who says, is it possible to switch my embryos to where you're at? And the answer is yes, we would be delighted and very happy. I'm at New Life Fertility here on the Gulf Coast in Pensacola, Florida. We have offices also in Panama City and Tallahassee, as well as Dothan and Mobile, Alabama. But we do see travel patients here as well. It's a wonderful place to come and get pregnant. I swear it is. Thanks, Victoria. We'd be happy to help you with that. If you just want to email me or message me through Instagram, I can connect you with the right folks. I am at CNY, but heard about you from so many from so many girls on the CNY Facebook groups. Talk about how amazing you are. Oh, you say all the right things there, my friend. Thank you. I appreciate that. Hi to Melissa and Brenna. T. Andres. Hey, good to see you. Any tips to improve PCOS? Why, yes, there is. Is there anything you can do about polycystic ovarian syndrome? Maybe. It's probably a genetic issue. It's multifactorial. What causes it? Well, it's really hard to say. There's probably not one thing that causes it, but what can you do to try to improve it? Well, there are different symptoms, right, that are associated with PCO. There is, typically your androgens, your male hormone levels run high. And so as a result, you get things like acne. As a result, you may have oilier skin. As a result, you may have male pattern baldness, which is, this here and this thinning up at the top. And I'm not going to turn around and show you because, yeah, I'm embarrassed about it. Okay. Thanks for calling attention to it. What else? You have insulin resistance, and insulin resistance can present itself with in a lot of different ways. Sometimes people have some thickening of the skin here on the neck, where that skin gets brown, or sometimes even under the arm. That has a name. It's called acanthosis nigricans. Sometimes in those folks, you'll also see a lot of little skin tags around the neck and under the arm. That's also, that's an insulin resistance thing. Weight gain, period abnormalities or missing a period, missing periods, chronically not ovulating, sort of goes along with polycystic ovarian syndrome, as well as a characteristic appearance by ultrasound of what the ovaries look like. So, yeah, it's definitely a real thing. What can you do about it? Well, you can always treat individual symptoms. But the truth is, there is probably one supplement that may make a difference as far as PCOS. Now, if you Google PCOS supplements or search that on Instagram or something, you are probably going to find, 1,000 different things of people that are trying to sell you stuff that may or may not be really all that beneficial. From a fertility standpoint, myo-inositol is very helpful. Myo-inositol is the same as the medication that we use, which is metformin. Myo-inositol is a supplement, it's a vitamin. You get it in any store. It is not a prescription, and it can significantly help with insulin levels and with normalizing, helping to normalize things and improve fertility with PCOS. Outside the fertility world, there are some other things, and let me just think, because I used to do that in kind of functional medicine gynecology, and now you kind of caught me off guard with that one. But the one that I remember called CM Core, CM Charlie Mike Core, CORE. But I am just blanking on what's in it. Berberine, I think it has some berberine in it. Berberine is also associated with helping insulin resistance and PCOS. That can be used, both of those can be used by both males and females, because it's not just a fertility thing. It's really a metabolic problem and can be associated with some bad things happening kind of at the level of the coronary arteries and all the other good parts on the inside there. Let's see, Annika Foster, thanks for being here. What do we have? Live Like Coco. Ooh, what do you think about the clinics that replace the mitochondria in the eggs with the younger donor mitochondria? Now, that's interesting stuff there, Coco, or Live Like Coco. That's called mitochondrial transplantation. And that is not done in the United States. Right now, I am only aware that it is done I'm blanking on it. There's two places. It may be done in Mexico, or no, actually, it's not done in Mexico. It may be done in some parts of the UK, but it is done in another place, kind of more routinely. They haven't reported the best outcomes with it because I think it's still really experimental science. Basically, what's happening there is that they are taking um, um, the DNA energy factory from an aging egg and putting in younger energy machinery so that that egg may function better or more genetically normal. Um, I would love to see that that works. I think we would all love to say, gosh, we have finally found a cure to aging as it pertains to um, as it pertains to fertility, and that may very well be it. It's just honestly not there yet. It's expensive. Their outcomes have not been as fantastic as we would hope. Is that because there's something wrong with the science? No, to me, the science makes sense. The problem is more likely they just haven't totally figured out the process. That would be my guess there. Special hi to Angela in the great state of, let's see. Is that Missouri? Is that? Oh yeah, Minnesota. They start with an M, so they're really hard to keep track of. Thank you, Angela, for being here this afternoon and enjoying some time with us instead of spending some time with your beautiful baby girl, who I was happy to be a part of her making. That's wonderful. Blackskin Beauty, hey, nice to see you. Macy Miller, Blackskin Beauty says, how long should I wait after being treated with methimazole for hyperthyroidism and Graves' disease to go for my FET? Hey, wow, that's a good one. So Graves' disease is an issue where the thyroid gland here from the neck gets hyperactive. It goes crazy and it makes you hyperthyroid. So what do you have to do in that case? Methimazole is a medication that sort of shuts down that hormonal function associated coming from the thyroid. How long do you have to wait? Well, so certainly I would want your levels to have normalized, because some people after being treated will then ultimately end up needing thyroid replacement. So you want to kind of ride the wave with it there. You want to go from it being too high to it being the TSH, or to the function being too high, to then the function maybe being too low, to then kind of getting back to where your steady state is. And that process may take you 6 months. So that's really the most important thing. You want that to be really all normal there. We got time, I think, for one more question here. If we didn't get to your question tonight, please feel free. Email me, would you? It's askfertilitywithfink at firstfertility.com. Askfertilitywithfink at firstfertility.com. I do see Bama Gal join me. That is my beautiful mother and father over there in Mobile, Alabama, maybe a stone's throw from where I am. I can't really throw a stone 90 miles, but you know what I meant by that. Mrs. Villarreal says, will spotting for 2 weeks leading up to an egg retrieval make you have bad results? No. A lot of times that's a hormonal issue. Remember, for when it comes time for an egg retrieval, we're really focused on the ovaries. So kind of what your uterus is doing isn't really the most important part there. So it shouldn't have any effect on you at all. And God willing, you will get through that. It's going to be big. I have my fingers crossed. Hey, thanks so much, everybody, for being with me here this Tuesday evening. Like every Tuesday at 5 o'clock p.m. Eastern, this is the place you need to be. Remember, this whole journey, it's not the book of your life. It's not your novel. What this is just a chapter. And what are we doing? We are rewriting it together. Every step forward with kindness, every step forward with love, and every step forward knowing that tomorrow is a new day that brings with it all new adventures. Follow me, would you, at Randy Fink MD on Instagram, New Life Fertility on Instagram. We are part of the First Fertility Network. Thanks so much for being here. God bless. See you next week. Good night. See ya.